Hello, I'm Dr. Paul Lynch. I'm an anesthesiologist and pain management doctor from Scottsdale, Arizona. And I'm the founder and CEO of US Pain Care. And today I'm launching the very first episode of the US Pain Show. And I'm so thankful and honored to have my very own lovely wife, Dr. Janne Lynch, join me on the inaugural episode.
Thank you for having me on your show.
Janne, thank you for joining us today. And I'm so excited to talk to you about dental care.
Fantastic.
So, I've been talking a lot this year about Suboxone. Suboxone is a treatment for opioid use disorder and has been shown to reduce the death rate by 50%. That means if you have opioid use disorder and you're treated with Suboxone, your chance of death goes down by over half. I've been teaching about this a lot on Instagram, on TikTok, on LinkedIn, pretty much anywhere where someone gives me a microphone. I'm going to talk about a better approach to treating mental health and addiction in the United States. But as I've started teaching, I've got a lot of feedback from our audience, and a lot of people have talked about a very particular side effect of dental cavities. And they've told me how they've lost their teeth, or their teeth have rotted out of their head, or they used to have a beautiful smile, and it's really kind of affected me emotionally reading some of these stories. And I thought, well, I happen to be married to one of the best dentists in Arizona, Dr. Janne Lynch, and I wanted her to come on my very first show to talk about this really important side effect of Suboxone, which is dental caries. So, Janne, could you tell the audience just a little bit about yourself?
I'm a dentist. I graduated from the New York University College of Dentistry in 2005. I currently live in Scottsdale, Arizona with my husband, Paul, and our children.
Five
Children.
Yeah.
And I own 4 dental practices. They're general dental practices, so we see a wide range of ages in the practices.
So you're a pretty busy dentist.
I am.
See a lot of patients.
I do.
And it seems like you're an expert on cavities.
I definitely am.
All right, well, having established you as the expert, I wanted to know if you could just start off by explaining what's the issue. Why are these patients with taking Suboxone, why are they getting cavities?
Well, Suboxone is a film or a tablet that you put in your cheek or under your tongue, and it sits there for about 15 minutes.
Okay.
There are 2 major issues or reasons that Suboxone can cause cavities in the mouth. The first issue is that it makes the mouth an acidic environment for about an hour after you take it.
Wow.
And when the mouth is acidic, the teeth become very fragile and they're easily damaged in that acidic environment.
Wow.
The second thing that happens with Suboxone, and it does happen with a lot of medicines, is that it'll decrease your saliva flow, and the saliva is very protective of the teeth.
Wow. So it's decreasing the pH or making it more acidic, and it's also decreasing the saliva that's bathing the teeth and keeping them healthy. That seems like a pretty big deal.
It's a huge deal. It's a big issue.
So is there anything we can do about this?
Well, the FDA did release some guidelines on what people who are on Suboxone should do. The first thing that the FDA says that you should do is after you take your medicine, after those 15 minutes are up and the medicine is completely dissolved, they want you to rinse your mouth with water and swallow the water. The second thing that the FDA cautions you against is brushing your teeth for a full hour. They say do not brush your teeth for a full hour after you take that Suboxone.
Wow. That seems like a big issue, right? And why is that? Why can't you brush your teeth?
Well, when you have a toothbrush with toothpaste on it, you have 2 abrasive things. The toothbrush itself is abrasive, and the toothpaste has some abrasive materials in it. If you take that and you put it in your mouth and you start to brush your teeth, the teeth are in a fragile state now. You'll literally brush your teeth away.
Wow. Now, is there anything else the FDA talked about that could help with managing long term?
Absolutely. The FDA recommends once you go on Suboxone that you get an appointment with your dentist as soon as possible.
Wow.
And then you keep up a close relationship with your dentist with regular dental checkups.
I mean, that makes a lot of sense. It feels like if we just do those steps, and I want to make sure I understand. So you take the Suboxone. At the end, you need to wash your mouth to clean up, to basically get all the medication off of your teeth and to help with the acidic environment. And then you swallow it, so you get the rest of the medication. And then you wait a full hour to brush your teeth, is that right?
That's correct.
And then make sure that I make an appointment right away with my dentist so they understand what's going on.
Yes, yes. And that full hour, also, you don't want to eat anything
Okay, that makes sense. Now, I've known you long enough and I've heard your patients talk about you that you always have some tips and tricks to make it even better. Beyond what the FDA has said, are there other things that you would do for a patient that maybe had a acidic mouth and maybe not enough saliva?
Yes, if you were a patient in my clinic and you told me, Dr. Lynch, I'm starting Suboxone, what do I need to know or what do I need to do? How can I keep my mouth and teeth in the best optimum oral health that I can? I would say, well, let's make a plan for what I would like you to do. I would like you to wake up in the morning and I would like you to brush your teeth and use a fluoride rinse like ACT. Then I would like you to eat breakfast so that you're not hungry later when you have an hour where you can't eat. After breakfast, you take your Suboxone, and then you would rinse with water, just as the FDA recommends. I would also recommend making a simple solution of 1 cup of water and a level teaspoon of baking soda. This is going to neutralize that acidic environment almost immediately. So this is going to have less time where your teeth are in that fragile state. I still don't want you to eat anything or brush your teeth for an hour after you do that. So don't brush for an hour after you take the Suboxone. At nighttime, I would like you to brush and floss your teeth, and then I would probably consider a fluoride treatment like Preventive 5000. That would be prescribed by your dentist.
So let me make sure I understand. So it sounds like, to help our audience remember, you don't brush for 1 hour after you take the Suboxone, but you want them to brush twice a day. So we can call that 1-2, right?
Yes.
1 hour you wait, but you brush twice a day. Is that a good, would you agree with that?
Absolutely, that's a great way to think about it.
Are there other things that you would recommend for patients that are taking Suboxone long term?
Absolutely, Paul. So the decreased saliva flow is a really big deal.
Okay.
So the things that you can do to combat that decreased saliva flow is to stay hydrated by drinking at least 8 glasses of water a day.
Okay.
So that's really important. If you notice your mouth is dry, you could chew sugarless gum.
Okay.
There are also really wonderful saliva substitutes on the market, like in a spray form, that I would recommend. If they can contain xylitol, that would be great. If you notice dry mouth at night, there is lozenges, xylitol lozenges that you can get at CVS or Walgreens or the grocery store. Those are called Xylamelts. I like those a lot.
I had no idea there were so many different ways to keep your mouth hydrated with more saliva.
Yes, many different ways.
So it sounds like treating the pH is really important, maintaining saliva in the mouth is really important, and then you talked about seeing your dentist. What else could the dentist do to help decrease your chance of cavities if you're on Suboxone?
Okay, well, Paul, that's a really great question. It's very important to see your dentist. They're going to have a lot of ideas based on your mouth and your age, what they can do. And some of those things would be sealants, might be appropriate for you. Fluoride delivery trays might be appropriate for you, or fluoride varnishes might be appropriate for you.
It sounds like when you get on Suboxone, it's really important to have your dentist understand that medication and work with you to maximize not only your overall health, but your dental health.
Absolutely, yes. Very important to see your dentist and get regular dental checkups, because if you start to get small cavities, they can be fixed quickly and they won't spread. And also, your dentist can go into some of those other modalities for delivering fluoride that might be more strong. You might need a stronger modality.
And I'll say, just from my experience, for some patients that have very severe dental issues, we could even switch them to other products like implantable versions of Suboxone, like Sublocade, that wouldn't hurt their teeth. But I guess the question I have for you is, if a patient told you, hey, I really don't want to be on the Suboxone, it's just bad for my teeth, like, what would you say to them?
I would say, you know what, please don't worry about your teeth. We can do many things to replace your teeth besides dentures or implant-supported dentures, many different things, but we can never replace you. So I would definitely recommend, if a patient has been prescribed Suboxone, that they would stay on it.
Yeah, I have to agree with that. You know, my experience in this space is that Suboxone is a life-saving medication. it has over 50% reduction in mortality. There was actually a recent study showing it could be as high as a 62% reduction in death rate. And so I would rather a patient stay on Suboxone and have a close relationship with their dentist to make sure that we can also protect their smile. But I think protecting their life is the most important thing that we can do.
Absolutely, Paul.
So, I appreciate you guys joining us today. I'm very lucky to have such a lovely, wonderful wife that could explain these things to us. If you guys have any questions, please feel free to put questions below in the comments, or you can go to our website at uspain.com and you can send us questions that way. My goal is to save 1 million lives through a better approach to chronic pain, opioid use disorder, and mental health disorders in the United States and around the world. I pray you'll join me on my journey.